Hello, everyone. I am Jess Finch, and I am your moderator for the day. Before we get started, I want to let you know that this session is brought to you by Responsive for CKD, an educational online community of more than 10,000 engaged patients, being supported by Otsuka Pharmaceuticals today in collaboration with Cookbook, a nutrition forward resource that provides recipes, guides, and tools for people living with CKD, and Happy Health Nutrition, an insurance-based virtual private practice focusing on kidney health. Today, we are here with Lauren. Hi, Lauren.
Hey, Jess.
How's it going? You are being brought back by popular demand.
I'm excited to be here and to be able to talk to everybody again. This is one of my favorite topics because when I get new people in to my practice, they always ask, how much protein can I have? Is it a no protein diet? And so this is a great topic to be able to talk to everyone and so that they can get an understanding of what is best for each and individual person.
Absolutely. And I think this is a record breaking webinar for Responsum, and we are excited. I think we have over 400 folks registered. So, I think folks are wanting the information. It's a great time to talk all things protein and CKD with family gatherings during the summer. And we're just happy to have you back. So I want to introduce you to folks that might not know you or have attended one of our webinars before so that they might be more acquainted before we start our presentation. So for those of you who don't know, Lauren is a registered dietitian who specializes in kidney health. She's worked with people with all stages of kidney disease since 2009. Lauren earned her Bachelor's of Science in Nutrition Dietetics and RD credential, from University of North Carolina, Greensboro, and her Master's in Nutritional Biology. Lauren is also a certified specialist in renal nutrition. So initially working in dialysis for a decade, then transitioned into preventative kidney health. But what I like and what I would love to highlight is your mission. And I think that is such a fantastic mission that you want to ensure that kidney nutrition is readily accessible to all individuals with CKD. And that is something I know Responsive for CKD also can really appreciate and align with your mission. So if you are ready, we would love to hear what you have to say about protein needs in CKD. And then we're happy to go through a Q&A, a live Q&A towards the end for folks that want to ask Lauren questions.
Well, thank you so much, Jess. And as Jess mentioned, she and I both reviewed all of the questions that you have already submitted. And I'm hoping that you'll get 90+% of the answers to those questions because there were some really great themes and that this presentation is going to cover. But any additional questions, throw them in there. And I'm hopeful that we'll be able to get to those as well at the end of the presentation. So protein needs in CKD. As I had mentioned, this is a topic that I get a lot of discussion on. And whether I am talking to somebody in my own personal client in my private practice, or whether I'm interacting with them as part of our nonprofit with Cookbook. And so I'm really happy to be able to talk through this presentation and go through with you all CKD basics and what protein is and why it's important. Talk about determining protein needs so that you're able to use this presentation as a launching pad to be able to take control of your health as related to protein. To discuss protein portions and the sources of protein. Review creating kidney-friendly meals, and most especially going through the Q&A together. So why do we even need protein? Protein makes up a lot of really important things in our body. You can see on this slide all of those important things. And we mostly usually think about muscle. Protein is our protein source being our muscle. And we need all of these things to be able to live and thrive. So it's important that we feed ourselves enough protein. But our kidneys are our filters, and protein is a little bit harder to filter than other nutrients. And so we want to feed ourselves exactly what we need and not more to be able to that puts pressure on our kidneys. So that's kind of the central theme we're going to be talking about today. As a dietitian and as a renal dietitian, my goal is always to prevent further kidney damage. We want to, regardless of stage of kidney disease or kidney damage, we want to maintain good nutritional status. Ultimately, we are more than our kidneys. We are a whole person that includes our heart and our brain and all of the other parts of us. We want to lessen the risk of progression of kidney disease, as well as optimizing the opportunity to thrive in total health. And what that really looks like is a generalized eating pattern for all individuals with CKD that is low in sodium, low in cholesterol, and heart healthy, that is personalized to your specific lab work. And this is what is so hard for anyone watching this that is on the other side of the computer, is that what works for one person with CKD may not work for another based on their individual lab work. And so many times if we are in communities or reading things online, what someone can do may be something different than what you've been told. And so our generalized eating pattern for kidney disease is really very individualized. And we want that eating pattern to be overall anti-inflammatory. And you won't be surprised by looking at the picture on this screen. I'm going to be talking a lot about plants, and our plants, fruits, vegetables. That's where we really think about anti-inflammatory types of foods. When I, as a dietitian, assess someone, I take multiple things into consideration related to protein. And this slide is indicated towards kidney disease, but it also is the general population to a certain degree as well. As we age and grow, protein is really important for growth. You saw on those slides earlier that our bones and our muscles and our enzymes and all these things are used. Protein is part of that. And so when we are little tiny babies and growing very, very quickly, obviously we need a decent amount of protein to be able to grow. Then we think about the stage of kidney disease, as well as our overall health goals. Are we in the process of building muscle? Are we in the process of recovering from injury or sickness or surgery? Or are we at maintenance? These are the types of things that we can take into consideration. So let's dig into them a little bit more. Age and protein. So you see on my one side, I've got those cute little babies there. And anyone who has been a parent or is a parent or has loved ones that has watched a child grow, you know that when they're little, they grow real quick. You go away for a couple of weeks, you see your niece or nephew, and they've doubled in size, it almost feels like. And so that rapid growth really is a higher need for protein. As we exit childhood and get into teen and then into adulthood, it's kind of like this curve you see where the need still goes up. But then once we hit adulthood and we're done growing, especially we think stature, then our needs start to flatten out. And then over time, as we're not necessarily building muscle, we're not growing people for those people who end up having babies, we are now not needing nearly as much protein because as the aging process happens, we are not, that just isn't what we need. So we want to think about that. Where am I? Where, and I say I, meaning you, where are you on the other side of this screen in that growth curve? If you're an adult, and most likely you are, then you're done growing. And so that protein need necessarily isn't there. You're at maintenance. If you're someone who is caring for a child with kidney disease, you may need to take growth into consideration. And in that case, you want to talk to your doctor or your child's doctor about how does protein and growth interact for your child's situation, especially related to kidney health. Then we think about these stages of kidney disease here. Okay. So if you are in stage 1 or 2, which we think about more as kidney damage. So stages 1 and 2 encompasses that GFR greater than 90 up to 60. So 60 to 90. You're really looking at a moderate protein intake of 0.8 to 1 gram per kilogram body weight. So we in the US work on pounds. In order to get kilograms of body weight, you take your weight in pounds and you divide it by 2.2, and that is your weight in kilograms. So you're going to take that weight in kilograms and then multiply it by 0.8 to 1 to find out the grams for you. Okay. And I'll say that again at the end of the slide because that's a lot of information, but I want you to grasp the real overall theme of this slide before your specific number. So if you're in stages 3 through 5, non-dialysis, this is where we think of that traditional lower protein intake and that recommendation for lower protein. You can see on the slide here, my low protein is split into 2 different categories. If you are someone who we consider nutritionally stable, meaning you're in good health, you don't have diabetes, you're not at risk for weight loss, unintentional weight loss, that is, then you are most likely in this 0.55 to 0.6 grams per kilogram body weight bucket. If you're someone who has diabetes, blood sugar issues, then you would fall into that 0.6 to 0.8 grams per kilogram body weight bucket. Now, this lower protein seems very drastic, but we're going to talk about that in a second. If you're on dialysis and watching this, that is actually, that moderate intake is actually more higher than everything else that we've talked about since, which is 1 to 1.2 grams per kilogram body weight. So the actual process of dialysis uses up protein, and we're also, our focus is no longer on trying to save your kidneys and prevent progression. It's now on optimizing your nutrition status, and dialysis is doing the work of the kidney. So that's why we go from that low protein to the much higher protein, is because in the low protein, we're trying to prevent progression. And in the dialysis section, we're trying to optimize our nutrition and health status. If you are someone who's had a transplant, many times when I talk to people with a transplant, they say, well, my doctor said I can do whatever I want. I'm good now. Well, really, we fall back down into that 0.8 to 1 gram per kilogram body weight. And what that is that actually is the recommended amount for all individuals for general health. So somebody who is not growing anymore, not pregnant, is not trying to be a bodybuilder, but just really is trying to live and thrive and reduce their risk for heart disease and all of those chronic diseases, that's 0.8 to 1 gram per kilogram body weight. So we then fall back into that stage 1, 2 or transplant. Now, what makes all of this so incredibly hard for all of us in the United States is that the standard American diet is actually more like 1.3 grams per kilogram body weight. So this is where my graph on the bars on the side of the screen come in. We're actually starting way up here, and then you go to the nephrologist and you're being told to essentially have the amount that you're already eating. And so that's why the restriction feels so significant, even though when you look at these numbers on the screen, it doesn't mathematically feel so different. So we want to really take each person into consideration. You take yourself into consideration. Where are you starting? What are your goals? And then you're able to identify, how much do I need to restrict? Do I need to restrict? So these health goals, I've mentioned this a couple of times. We want to make sure that it's not a no protein diet. We want to minimize the risk for malnutrition. Okay. If you're not in good nutrition status, if you're so scared to eat anything that you're starting to lose weight unintentionally, and especially muscle mass, that's bad. If you have diabetes, you may need a little bit more protein, not nearly the standard American diet. So it's still going to be a restriction if you're starting from there, like most of us would be. We want to take into consideration exercise. Now, exercise and kidney disease, they work hand in hand. It does not necessarily require that you have extra protein in order to meet your exercise needs. But what it may mean is that after exercise, you use some of your protein allowance to eat something afterwards. So exercise before breakfast and having breakfast as an example. During pregnancy, our health goals are different related to protein, weight loss. And then with high urine protein, we want to make sure if you are losing or spilling a lot of protein in your urine, that you are following these guidelines on that previous slide to make sure that you're right sizing the portion of protein that you're feeding yourself. We don't want to overtax our filter, and protein is hard on our filter. So it's that same type of idea. And just to briefly go through again, to find our kilograms body weight, we take our weight in pounds and you divide by 2.2. Okay. So foods that contain protein. Most clients that come to me know already: chicken, fish, beef, pork, game meats, eggs. They talk a lot about that. We all know that. But plants can provide us with all the protein that we need. Beans, nuts, legumes, tofu, peas, whole grains like whole grain pasta or quinoa, things like that, seitan. There's many more options in the plant section that is on this slide, but I wanted to call out those bigger opportunities for protein as a way to introduce this idea that how do we balance our nutrition needs with limiting our protein. So this is becoming quite the controversy in the CKD world. Plant versus animal. Do I have to be vegan? Can I get all that I need from plants? How do I get all that I need from plants? What if I have just a little bit of animal protein? How much can I have in a week? So a lot of those questions really are personalized, and you want to be able to answer that for yourself. If I, Lauren, say to you, you have to be vegan, and that instantly puts you in a defensive and I can't do this, then that's probably not the right option for you. The reality is that animal protein is high in protein. It's very protein dense. It does contain cholesterol. We're talking about eating animal flesh, muscles. And animals have a liver and they produce cholesterol. It's low in fiber. We get fiber from plants. It has a high acid load, and we're going to review this on the next slide, but I want to highlight now, it doesn't mean it's acidic like you think tomatoes are acidic. It means it produces acid. And yes, animal protein can be high in potassium. This presentation does not talk about anything else other than protein, really, but it's something to consider when your doctor or something you read online mentions that, oh, you can't have beans or nuts, that's too high in potassium, but doesn't acknowledge that there is, in fact, potassium and a lot of potassium in some meats and animal sources, that there is opportunity to have plant sources on your plate when you're removing those animal sources, because you're switching out a high potassium source and putting in another high potassium source. So animal protein does have potassium. We just often don't get reminded about that at the doctor's office, or sometimes online. Now, one thing that animal protein does have in its favor, because I feel like I'm knocking on animal protein a lot here, is we think about tuna and salmon and sardines have omega-3s, which can be anti-inflammatory and that good fat that we think about that helps to control the bad cholesterol and limit and lower our triglycerides. So we do want to make sure that we acknowledge that. Now, plant proteins on the other side, they are generally lower in protein compared to their animal protein counterparts. So if you were to look at similar sizes, we'll show those, you might find that those plant proteins have less protein in that same similar weight or space that they take up. There's not cholesterol in them. They can be high in fiber, which is great for heart health. They can have potassium, and potassium, although gets the shaft a lot of times in the renal diet because we're worried about our blood potassium getting too high, potassium can actually help blood pressure quite a bit. So we want to make sure that we give both sides of that potassium debate a honor in this part on this slide. And then they're a lower acid load, which means they produce base and help do the work for the kidneys. So let's dig in for a second on this whole acid base part. So our kidneys help to actually keep our blood acid base in balance. And so as our kidneys are not working as well for ourselves, that becomes harder to do. And what we feed our body actually can make the kidney work more or less because of it being a filter. So acid producers or animal proteins, they actually make acid. So then our kidney has to squash it back down and get it back into range. Whereas plant proteins, they push up the base and help to do that work of the kidney and keep it in a nice range. So ultimately, when we add plant foods and decrease animal sources, we help to do that natural balance for our system or for our kidneys themselves. And if you have an animal protein, pairing it with a plant like vegetable or fruit helps to balance your plate equally that way. So what are our protein recommendations? So earlier we went through, you found your number of grams of protein, okay? And if you haven't done so and you're watching this recorded, I would recommend pause, go back, figure out how many grams of protein that you need. And then here are what our serving sizes are. This doesn't mean portion, but this means serving sizes. Our typical serving size for nuts is a 1/4 cup or about a golf ball size. And that actually gives us 6 to 8 grams of protein. So things that we can add nuts to are things I always think about: oatmeal or yogurts. And that can help to boost our protein content of that meal. Nut butters and hummuses, things like that, are 2 tablespoons or a ping pong ball. It's very similar to our golf ball in size, just slightly different, and has, as you kind of expect, similar protein content. And so those are decent portions because they're so nutrient dense, but it isn't very large per se. Now, when we think about our animal sources, fish, and especially like things like tilapia or flounder, where they're naturally thinner, 3 ounces is the size of a checkbook, or maybe like your phone. And that actually gives us 18 to 25 grams of protein. But, or the same for meat, and this goes for fish included as well, the thicker cuts of fish like tuna or salmon or something like that. We look at that deck size of cards, and that is both in height and width, like a true deck of cards. And I don't know about you, but I can't remember the last time I've seen a chicken, a pork, a steak, a fish come to me in exactly that size and portion. And if it did, I'd kind of be a little grossed out, because they're supposed to take form as their natural selves. So it's really hard to estimate what is 3 ounces. Is it a deck size of cards or not? And then lastly on the slide, you see our half cup portion. And those foods that fall into that are beans, tofu, and lentils. And they typically give us 8 to 10 grams of protein. They also give us a nice amount of fiber too. And that is about a half of a baseball size. Now, I always recommend for things like our nut butters, our nuts, our beans, tofu, lentils, when you're portioning out your foods on your plate, get out your measuring spoons, get out your measuring cups, and actually portion out so that you can see what it looks like. The meat sources are a little hard, but what you can do is put a deck size of cards and sit it on your table, so that as you portion out your food, you can at least eyeball next to each other how much different would I have served myself, and then cut it down to be that deck size of cards. So I talked about my meat coming out as a deck size of cards and how that would gross me out. I just simply Googled and tried to look up as best I could, because there's not a lot of really great research on a lot of these things, but the typical portion sizes of what we get in the grocery store and at restaurants, right? So this is obviously going to be all over the place, but I wanted to show you all the difference between our deck size of cards, or our checkbook, or phone size, versus what we actually are eating. So most grocery store chicken breasts are actually 6 to 8 ounces. So instead of the 20 to 25 grams of protein, we're getting 52 grams of protein in that. And our salmon oftentimes is 5 to 7 ounces, which is 28 to 40 grams of protein. And protein drinks, so if you're making your smoothie and trying to really maximize blending up your vegetables and getting all those good nutrients in, protein powders and protein drinks can be anywhere from 20 to 40 grams of protein. And so we want to be aware of all that added protein and how we're using it. And then hamburgers, I mean, you can get them all over the place, are 4 to 8 ounces and 21 to 37 grams of protein. And so, again, standard American diet being that 1.3, that bar graph that was so high, versus what we actually need. And this is where you can see that portion distortion comes in. So what we want to do is right size the portions of our plate. On our left side, you see we've got our chicken breast that's taking up the plate. And we want to change from that standard American diet side over to the other side, where instead of our main event being the chicken, have our main event be the vegetables or the plants on your plate. What that allows for is to get closer to our deck size of cards and right size the amount of protein that we actually need. And then many times too, you look at my quinoa, that's what those dots are, at least in my head when I made this slide. You can see how the chicken is a huge part of the plate. And then we've got the quinoa, and yeah, sure, we eat those vegetables, but they're really kind of there, but not really. And so we want to make sure that we go from vegetables with chicken and quinoa instead of chicken and quinoa with vegetables. So that actually breaks down into half of our plate being from vegetables and fruit, 25% from protein, 25% from whole grains, and then utilizing oils sparingly because they are very calorie dense, and encouraging water and hydration. So it's important to also know that even though this balanced plate is kidney friendly, it is also diabetes friendly, heart healthy, cancer friendly. It is weight maintenance friendly. And so this actually supports all of our eating patterns by eating this way. So let's go back to this right sizing of our portions. We have experienced an increase in our food costs over the last year or so. And there is an idea that eating healthy is expensive. And I wanted to take this opportunity to talk about what are the ways that we can eat healthy and not break our budget. One of those ways is to definitely right size these portions. When you look at my plate on the left side and you see how big that chicken breast is, if I am able to cut that in half and use that as leftovers, I am automatically taking what would have served me for one meal and turning it into 2 meals. That in itself can help save money. The other thing is choosing foods that are in season. So when we think about produce, especially, in season produce is always going to be less expensive than, and tastier, honestly, than out of season produce. Utilizing frozen vegetables and fruit is a great way to reduce cost, and is actually just as healthy to have frozen as it is fresh. And so that's a nice added benefit as well as a little bit of meal planning goes a long way. So if you were going back to my plates here, if I was cooking, I don't want to cook. I love to cook, but I don't want to cook every day, all day long. If I am just focusing as I make my grocery list and plan out a couple meals and buy the foods on that list only and use the foods from that list in multiple ways throughout the week, then I am reducing my food cost, potentially reducing my time in the kitchen, as well as increasing my health by adding those vegetables and right sizing my portions. So let's look at specific examples because not everything fits on that plate perfectly, right? So I've got three examples for breakfast. If you take your weight, divide it by 2.2, and then multiply it by your stage of kidney disease. So if you are 3 through 5, it's going to be your weight in kilograms times 0.6. We'll just make it easy, 0.6. You're going to get your grams of protein per day. Now, assuming that you eat 3 times a day, I'm going to say if I'm supposed to have 60 grams of protein in a day, and then I divide that by 3, I've got 20 grams to play with, okay? Now, these breakfasts are all well within that range. And to be honest, most people kind of fall in the 45 to 65 gram range. There are reasons to adjust body weight. This is not what this presentation is for. And this is why I really encourage, if you're struggling and having a hard time with this, reaching out to a renal dietitian. But you can see my oatmeal, my tofu, and my berry smoothie all contain at least 12 grams of protein. All 3 are plant-based. Because all of them are predominantly plant sources. Even the middle one, that's tofu egg scramble. So this is just a basic recipe of if you used a 1/2 cup crumbled tofu or 2 eggs. That's why there's a variation there. But you notice there's a cup of vegetables. I would chop them up real small and saute them all together, and an apple. So this tofu egg scramble falls into my nice little plate. It might not portion out perfectly, but it is predominantly vegetable and fruit based. It allows for some protein, and then we've got some carbohydrate in there. The oatmeal as well, we've got a whole cup of berries in there. You've got your walnuts for protein, and you've got your oatmeal for your whole grain source. And in that berry smoothie, we've got some hemp seeds that give us omega-3s and some protein. We've got that fruit in there, and then the coconut milk, which is allowing for some calories and total fat there. Some other examples would be lunch. We've got quinoa salad. The same principles throughout this exist, and you can see I've even thrown in tuna here. That gives us 25 grams of protein. Now, this example of tuna doesn't, it's just the tuna salad itself. I should have probably given us some greens here as well, but I wanted to show and acknowledge that you can have quinoa salad, you can have a hummus wrap, you can get a decent amount of protein in these vegetarian sources, and still be within your guidelines. And then for dinner, these plant-based sources here, because yes, there are animal products on the salmon and veggies, but we've got a whole cup of asparagus and 2/3 cup of brown rice. You can see our tofu stir fry only provides 15 grams of protein, which is well within our amount. And then that if I'm trying to hit the 20 grams of protein in my per meal, the salmon with veggies is over that 28 to 30 grams of protein. And that might be fine for me if I had the 15-gram lunch and breakfast. I might have some wiggle room in my protein budget to have this one day. And so it's all trying to look at how much you've eaten in the day and how much you have left. It doesn't require a lot of food math. I only do this food math for you as an example to show you how they fit. But if you follow that balanced plate, you will find that they all do fit. So it's important to understand that protein is just one part of the equation for kidney disease nutrition. We want our plate to be filled with those fruits and vegetables, to add our fiber, to be high in fiber. And if you need to follow a potassium restriction, choose lower potassium options. There are plenty of them, and they all taste great. We want to make sure that we are still feeding our body and protecting our hearts by exercising, managing our blood pressure, and taking our medications as we should, not smoking, and building ourselves a holistic plan for health. And protein is just one part of that. So in summary, we want to eat how much we need and no more. We want to make food situations based on our own labs, on our own financial constraints, on where we live, what's in season, what we like. Gosh forbid our food tastes good, right? And we want to choose plant-based options more often than animal sources. We don't want to forget about healthy fats and incorporate those into our meals. And we want to make healthy choices most of the time. No one meal is going to ruin your whole kidney health. And so you want to be consistent, not perfect. And when you need help, seek help from a professional to help you understand your individual and personalized needs. There are people like myself out there very willing to help you with figuring this out so that you are feeling confident and you're protecting your kidneys and thriving. Here are some of the resources that I used. And with that, I'll start the Q&As that we pulled from our pre-done questions. Okay. Before I do that, I do want to take a moment and say thank you so much to Responsible for CKD. They are wonderful partners and giving me this opportunity to speak to you all again. I love doing this and I love working with this group. And so I just want to say thank you very much for you all.
Yeah, for sure, Lauren, we appreciate you too. And I just want to highlight a couple of things that you mentioned during your presentation. The importance of like being consistent, but not perfect. I think that is just such a wonderful tidbit as we move into the question and answer section, because folks want to get it just right. And that perfection is somehow maybe unattainable in some, because we're all human. But as you were talking, I did grab some hummus for a snack. So all is not lost. And I wanted to mention that. So yeah, we'll definitely move into our Q&A, and then we'll get into some live questions.
That sounds great. Yeah. So the first question on the screen, and we saw a lot of these questions, right, Jess, that came across around diabetes and CKD. There is an idea that somehow these are competing eating patterns, and in fact, they're not. So I did answer earlier that for people who have diabetes, that the protein recommendation is a little bit more liberal if you have CKD stages 3 through 5 non-dialysis, and that is 0.6 to 8 grams of protein. That plate method that I discussed a lot, it is exactly the same and beneficial for someone with kidney disease and diabetes as well. And when it comes to dialysis, it's the same protein amount regardless. So it definitely, this theme aligns both with CKD and with diabetes. The other question that we got a fair amount is how much protein per gram should you have if you have IgA nephropathy? So for those who do not have IgA nephropathy is in fact a rare form of kidney disease. It typically affects individuals at a younger age, and it is an autoimmune type of kidney disease. It is the most common of those, but it's still extremely rare. And part of what is IgA is that you lose a lot of protein in your urine. And so people get very concerned about protein intake because they're spilling a lot of protein. You still want to follow the guidelines that we mentioned based on your stage in the presentation for IgA nephropathy. If you are somebody that is younger, and I did mention, growth in here, you want to make sure to review with your doctor to ask about how strict of a restriction, or to work with someone that understands both IgA nephropathy and growth for that. But you should be able to, if you're an adult, you should be able to follow the protein recommendation and right size your portion size based on that slide. So any advice on how to keep a balanced diet or kidney-friendly diet for a preteen? So this is a great question, and we actually got this question more than once, and so I wanted to highlight this. For any of those of you who have a preteen, myself included, we know that this is an interesting time in life for them. And if you remember yourself, what it was like to be that age, there's a lot going on socially, emotionally, as well as growth. And so thankfully, from a growth perspective, although teens and preteens are still growing, that curve, they're past the biggest part. And that highest trajectory of the growth that we experience in early childhood is done. And so you still want to make sure that you're getting the right amount of protein, but you're not nearly likely to affect stature or the opportunity to grow. And so following up with their individual nephrologist or physician or dietitian is a really good choice, but know that, like, from a parent worry perspective, that biggest part of growth has already happened. Now, when it comes to the social, emotional, all of that comes with teenage years and adolescence, this is where you want to make that personalized choice for yourself with your child on where the fight is and how much of the fight to do when it comes to food. And then the other thing, and this is such a hot topic, so I think I was biased. I pulled this question out. Are plant-based meat alternatives or cultured chicken better than regular meat? So plant-based meat alternatives are becoming super common, which is great in many, many ways. However, depending on what type of plant-based meat alternative you're talking about, they can have potassium additives. They can be high in sodium. And they can also be very protein dense. The more typically, and this is me making a generalization, the more that it looks like meat, the more it's wanting to be meat. And so it's going to be just as high in protein. So if your goal is to eat this alternative so it's lower in protein and more kidney friendly, it might in fact not be. If you're eating something that you can identify, like a veggie burger that you see rice and you see beans and you see, most likely it's going to have less protein. If it's not homemade and comes from a package, then you have the wonderful opportunity to read the nutrient label. And so what I would say is that these products can be used in moderation, but should be used with knowledge and read the labels before you make your choice. And so that's the end of our pre-done questions.
Wonderful.
Yeah.
Well, I only say that because we are getting tons of questions in the chat, and I know folks are eager to get their questions answered. So I wanted to hop in there and let's just get started with that. So we have a question. Are strenuous workouts okay? Or do I need to be concerned about damaging my kidneys due to hard workouts?
Yeah, so that's a really great question. So what I would say is we all, after a strenuous workout, kidney disease, no kidney disease, we all lose a little bit of protein in our urine post-workout. So you want to make sure when it comes to strenuous workouts, one, you always want to ask your doctor about safety, because you want to make sure your heart is strong enough that you're not going to do anything that you don't realize. But that after that, then you want to personalize it based on your needs. So my recommendation of eating after your workout and using the protein from the meal post-workout to replenish what you've used in your exercise is a great way to not overdo your protein allowance.
Okay. How about, oh, they're coming in fast. Okay. So what about dairy products? How much protein do they have, and what are your recommendations there?
Yeah, so dairy products are all over the place in the sense of, well, animal dairy or non-dairy milk dairy alternatives. So if we're talking about animal dairy products, yogurts and milks, milk typically has about 9 grams of protein, and and yogurt is all over the place between 9 to like 19 grams of protein. Those non-dairy counterparts typically have less protein than the animal dairy products. The plant products have less potassium, but the plant products do have additives that you want to read the food label for, because they're trying to be dairy products. And what do we get in dairy? We get calcium. So a lot of times the way that the manufacturers add calcium to non-dairy alternatives is by binding it with something like phosphorus. So you might see a calcium phosphate. So you want to read the label, because that's not every product. There's lots of products that are good. And you may be very much drinking or eating the product that is just fine for you. So non-dairy, just read the labels. They're going to be a little lower in protein. Dairy, they're going to be a little higher in protein and potassium. And so depending on your needs and your goals and how much, if it's a splash in your coffee and truly a splash, probably negligible. If it's a latte, then that would be a big amount.
Wonderful. Okay. Are there types of proteins that shouldn't be combined in one meal? For example, chicken and burgers with avocado.
Yeah. So the protein itself is not an issue. It's more about the amount. So typically what I will recommend as just a generalization is to choose vegetarian or not. Don't have, beans and chicken on the same plate because they're both protein sources. Or don't do hummus and chicken on that wrap. Choose hummus or chicken because they're both protein sources. So, but it's not necessarily about the specific type of protein. It's more about your protein budget or allowance.
All right. Thanks, Lauren. Wow, you're blazing through the questions. How you doing?
I'm doing good. How are you doing?
Okay. I'm doing good too. All right. Let's continue.
Let's say keep them rocking and rolling.
We are rocking and rolling. Okay. This is an is it true question. Myth busting. I know we did this during our last webinar, and it was pretty popular. So this is a myth buster. Is it true that it takes longer for plant proteins to rebuild muscle than if I was eating animal protein? I'm trying to rebuild 6 pounds of muscle due to illness.
Oh, that's a great question. I'm honestly not aware of why that would happen, like why plants would not be as efficient as animal sources. Instead, it may just be about getting enough and the idea that you can't get enough. But I will tell you, I have had I've had clients who have gained weight on peanut butter and jelly sandwiches and have seen, you know, like that be part of muscle, like total growth, not just fat growth by any means. And so it's not necessarily that you need animal protein.
Yeah, it's funny that you mentioned peanut butter and jelly. Like my toddler, that's how we survive on protein right now.
Right,
exactly. I'm so
exactly.
thankful that he does not have a nut allergy.
Yeah,
because that's what we use.
That's
okay.
right.
Okay, regarding transplant and protein, is there a waiting period following the transplant before someone can return to that normal protein intake amount?
Yeah, that's another great question. I love these questions. I get so excited. So, and if the person who's asked this question has already had a transplant, they're going to know part of this experience. But immediately post transplant, they're going to take labs very frequently, and how quickly your kidney wakes up and starts working is different for all people. A lot of people, their kidney wakes up and starts working immediately, but some people have a sleepy kidney that might take a little longer for it to get going and doing its thing. So the immediately post transplant, you really want to be very specific towards your what your doctors are saying and immediately after, because yes, to recover from surgery requires protein. You need protein for healing. But if your function isn't back up to snuff, there may be some other recommendations made. So it becomes very individualized. But a great question.
All right, we're getting some formula questions again, and the per day, whether or not these formulas you provided were per day. Could you please repeat the protein equation again?
Absolutely.
And for stage 3A.
Yeah. So the protein equation, you're going to take your weight in pounds. So if I weigh 170 pounds, I'm going to divide that by 2.2. And that is going to be my weight in kilograms. I then multiply my weight in kilograms by the stage of kidney disease. So if it's stage 3A, then we're going to do 0.6. There were some other nutrition, like nutritionally stable or not nutritionally stable. So it'd be 0.6 is a great place to start. So 170 divided by 2.2 times 0.6 will give you that daily allowance for protein. I then, to get more confusing in food math, I then will take it and divide it by how many times a day somebody eats, so that you've got an idea of like how much can I have per meal, but that will give you the per day amount. Now, it's important to know, and this is where individualized care is very essential, that, sometimes when we are in larger bodies, that number is a little skewed higher, but it's a great starting point for somebody watching this.
Okay, wonderful. Okay, a couple more. I love veggies. However, I have a condition which precludes me from eating a lot of veggies. I pay daily for a side salad. Any suggestions about CKD friendly supplements?
Yeah. So I'm assuming, are we talking about, so I guess my question is, so if it's veggies that is our real worry and concern, what I would say is make yourself a list of the veggies and the fruits that don't upset your stomach, and start there with how you can get your fruits and vegetables in. If you're concerned and worried about getting enough vitamins and minerals in, um, there are some supplements we recommend for people in later stage kidney disease to only really supplement the B vitamins, but in earlier stages, there's opportunity to take supplements, general multivitamin. But I'm a whole food first person, and I would make that list of what you can actually tolerate, because that supplement isn't necessarily going to include fiber, and you want that fiber, and we want all the other things that go with it. So it's definitely food first is the best mentality.
Okay, one more. Can you comment on Asian foods? We mostly have salt and soy sauce.
Mhm. I love Asian foods. That's my comment. No, I'm kidding. But it's also my opinion. So yes, soy sauce and fish sauce and those types of things are very high in sodium or salt. And so a easy switch out is coconut aminos. Coconut aminos are much lower in sodium or salt than soy sauce. I like to, when I do stir fries and things like that, I like to make the food unseasoned, and then at the last moment hit it with just a tiny bit of the coconut aminos mixed in, so that the flavor is real forward, so it doesn't cook off and then you feel like you need to add more. So I like to do it at the end, and that really helps to bring it forward, as well as utilizing other veggies in those that might enhance flavor. So onions and chilies and things like that, that might really also bring out, so that you're not trying to just overcompensate with the salt.
Well, Lauren, thank you so much. This has been so informative, and we appreciate you for sharing your knowledge on just nutrition and how we can better take care of our bodies and our whole selves. And thank you so much to Cookbook and Happy Nutrition and our sponsors with Otsuka Pharmaceuticals for allowing this to happen. I want to let everyone know, if we did not get to your questions, it's okay. You all that have registered will receive an email with this session, and we've recorded it so that you can pause and reflect and go back and write down if you didn't catch the formula or anything else that we mentioned that would be helpful for you. And if we did not get to the questions, don't worry about that either, because we are logging the questions and we will get those answered if we did not get those questions answered live. So we appreciate everyone's engagement and your attention today. Lauren, do you have any last words or final thoughts you'd like to share with us?
Other than my immense thanks to you all, because I love coming on and doing this. The other thing I would say is, don't get lost in those formulas. Don't get lost in the food math and the food noise that sometimes talking about these subjects lends us to. Instead, follow that balanced plate, and you will definitely see some results, both in confidence and in well-being.
Wonderful. Right. We're consistent. We're going for consistency, not perfection.
That's right.
All right, everyone. Well, thank you so much for joining us. And until next time, we'll check you later.
Thank you, guys.
Bye-bye.